A significant part of WHO's response to health emergencies in Uganda, DRC, Gaza, Sudan, and elsewhere is supported by funding from the United States. As we have said, we regret the announcement that the United States intends to withdraw from WHO, and we would welcome the opportunity to engage in constructive dialogue. There are also actions that the US government is taking that are unrelated to its intended withdrawal from WHO, but which we're concerned are having a serious impact on global health. For example, the suspension of funding to PEPFAR, the President's emergency plan for AIDS relief, caused an immediate stop to HIV treatment, testing, and prevention services in the 50 countries that PEPFAR supports based on bilateral agreements. Although a waiver has been granted for life-saving services, it does not include prevention services for some of the most at-risk groups. Despite the waiver, clinics are shuttered and health workers have been put on leave. WHO is gathering data on service disruptions and supporting countries with mitigation measures, including by filling gaps in supplies of antiretrovirals. The sudden suspension of US funding and the sudden disengagement of US institutions is also affecting the response to global efforts to eradicate polio and the response to mpox epidemics in Africa. In Myanmar, almost 60,000 people, most of them women and children, have been left with no access to life-saving services. And we have limited information about the spread of avian influenza among dairy cattle in the US or human cases. We ask the US to consider continuing its funding at least until solutions can be found.